Why are antibiotics losing power, right? We've been reading about antibiotic resistance. We've been talking about it in conferences. Let's talk about that in this channel. I'm Dr. Eva Amwai, a regulatory affairs pharmacist working in sub-Saharan Africa, and let's talk about these phenomena. And maybe let me try and dissect it for the common people. First, we are taking antibiotics for everything. And this way, we are teaching the bacteria how to survive the antibiotics that we are taking them. Now, antibiotics are meant to treat bacterial infections and only that, right? Not all fevers, right, are bacterial infections. Yes, some may be, but not are bacterial infections. Not all common colds deserve an antibiotic, right? If it moves to another stage where the infection has gone deeper and the doctor feels you need an antibiotic, fine. But most of them don't need an antibiotic, right? Not every sore throat deserves an antibiotic, but across many communities, and I must say across Africa, because we are so used to just hitting a fly with a hammer, we're like, I'm going to take this antibiotic so that it can treat whatever I am suffering from. Just listen to ourselves, the way we say it. We say, I'm going to take this medicine. And in Kiswahili, I can say it. Ndachukua hii dawa ndo ifanye itibu kitu yote niko nayo. You don't even know what you have, but you're just feeling unwell. You're like, let me grab an antibiotic. And unfortunately, practice in African communities is not that strict. Sometimes, and maybe 90% of the time, you will get an antibiotic over the counter. So I just want to say that sometimes you need a proper diagnosis to use these medicines. So what's happening when you take this antibiotic kutibu kitu yoyote yenye iko kwa mwili yangu, that is using it incorrectly. So when they are not needed in the first place, you're using it for the wrong use, right? And then most commonly we skip the dose. And I will talk about my people. The first thing, when I was in hospital pharmacy, anyone doing an antibiotic dose, if it was Friday, everyone would ask me, can I start this on Monday? And I'd be like, but you're feeling sick. And they'll be like, no, I want to go here and have a party here and have a this here. Can you interact with my alcohol? So, my friends, we are, number one is alcohol, number two is an antibiotic. I think many people have missed doses just because of this, traveling, many other purposes. So if you stop the treatment halfway or skip a dose, the bacteria can quickly adapt to the microbial you've been given. So it becomes resistant and therefore it works less. So next time when you have this, wacha nitatreat kitu yote kwa mwili yangu, you go take it, it doesn't work. Now then you say, okay, let me go to hospital. Then you're given a stronger antibiotic that costs more money, and that's the way it happens. So let's call it microbial resistance. I've talked about why Africa is vulnerable. First and foremost, I feel that the real public health initiatives in Africa have been improving, but they need to improve more and do a lot of health literacy with regards to antibiotic resistance, because hospital stays are longer, pharmacies are far from people, and people are only able to go to hospital because they have an off day or in the evening or in the morning before they go to work. And I do understand that the economy in Africa is a working economy. You can't afford to miss one day of work. You cannot. Therefore, we have resorted to treating ourselves and also buying these antibiotics by ourselves. What does this do? It increases complications and it reduces better outcomes. So in our setting, the problem is made worse by a few realities. right? And I've talked about them: access challenges, self-medication, limited diagnosis, medicine sharing, and the assumption that strong antibiotic is the best solution for everything, right? I think what we can do is to never take an antibiotic without medical guidance, right? It's plain and simple. Don't take an antibiotic without medical guidance. And when you're prescribed for, please complete your course. Every single tablet has been calculated to treat that disease, right? But make sure also you only buy antibiotics from registered pharmacies, because what is happening is there's also a lot of counterfeit or substandard antibiotics. What happens is substandard antibiotics, if bought from unregistered pharmacies or untrusted supply chain, where we don't trust the supply chain, what happens is the product has a small amount of the antibiotic and therefore causes some form of resistance because it's not enough. It's not enough to fight the antibiotic. So always check in your country's regulatory mark for packaging for the pack. Always check for the pack if there is a registration mark, and have this conversation with people around you, and especially pharmacists or medical doctors or any health practitioner you trust about the antibiotic you're using. Ask them what's the best way to take it. Some medications are taken before before food for better absorption. Some are taken after food. Not everything is taken after food, like the way we have done. And also, please, I just want to talk about a little thing called 1 times 3 or 1 times 2. So 1 times 3 or 1 times 2 has been equated to after meals. And normally we take our breakfast and our lunch and our dinner, but they are not always 8 hours apart. Now you just need to know that you need to take these antibiotics or whatever microbes you're taking according to the hours of the day. So if you're taking 1 times 2, it means every 12 hours. If you're taking 1 times 3, it means every 8 hours. So I hope I'm making some sense and you're learning. I think the risk of us experiencing antibiotic resistance is very, very high if we continue to practice the way we are. So please stop misusing antibiotics. We risk entering a future where common infections become dangerous again. We should be concerned for all of us. Antibiotics are powerful, so share this with someone who takes antibiotics without prescription. I know you know them, and it's because education is the first line of defense. Follow for more videos about this.